Okay, now it's 10 a.m. Let's start my first ever Facebook Live Q&A about plantar fasciitis. So in case you don't know what is plantar fasciitis is a very common pain happen among the runners. So this is how your foot looks like, okay? And then people with plantar fasciitis, they tend to have problem at the bottom of the heel, sometimes at the middle of the arch. Worst pain happen first few steps in the morning, in the beginning of the running, and after the running, and the next day after the running. So a little bit of self-introduction in case for those of you who don't know what I do, I'm a physiotherapist. So my job every day basically is to answer 3 questions. So runners will come in, they will ask me, when can I run again? Okay, question number 2, they will ask me, can you tell me why am I getting the pain? I see my friend run more than me, run faster than me, but they seems to have no problem, but I'm the one to have a lot of problem. Okay, so I have to answer this question. Okay, question number 3, they will ask me how I fix this, how do I fix this problem. I have been stopped running, after I stop running, I feel better. The moment I go back to running, the pain come back again. So the vicious cycle happening over and over again. Okay, so before I talk about plantar fasciitis, let's talk about running injury. So according to research, the research from US, they actually identified there are running injury happen in 70% of the runners. So injury number 1 is unfortunately blister. But I cannot have a blister, so let's pass this one. So injury number 2 is knee pain. Yeah, so knee pain is considered in terms of muscle and joint pain, knee pain is one of the most commonly seen problem among the runners. So number 2 is heel and ankle problem. Okay, and number 3 is hip problem. Hip problem meaning buttock pain, back of the thigh pain. Okay, so I choose to talk about plantar fasciitis because if you know someone who has plantar fasciitis or you have plantar fasciitis, you know it takes minimum 1 or 2 months of no running to feel a little bit better. If you're lucky, you will feel 100% better. If you're not lucky, then you'll feel the pain for at least 6 months or even up to a year or 2 years. Yeah, so this topic is very important. So now, before we talk about why are you getting running injury, let's talk about what are the risk factors that put runners in high risk of getting running injury. So number one is your body weight. So research has been showing if you have high BMI, meaning if your weight is higher than what you're supposed to be, that's why they use BMI, because if you're taller, you'll be heavier. So if your BMI is more than 21, that means you are overweight. So if you're overweight, you're at higher risk of getting running injury. So in case you don't know how to calculate your BMI, so use your body weight. Let me type in the comment, body weight in kg divided by your height in meter. Yeah, your height in meter 2 times. Okay, then you will know your BMI. Yeah, so secondly, history of injury. Like for example, when you were younger, you play other sport, badminton, basketball, martial art, tennis, you injured your leg before. So when you're older, compared to other runners who have no history of running injury, you're at much higher risk of getting injury. Okay, so the next one, the last one, is training error. So training error means your running technique is not correct, your running mileage is incorrect, or you increase your mileage too fast, and then follow an inappropriate training program. Yeah, so the training error actually happen about 60% in the runners. So most of the runners, when they come in with running injury, a lot of time I can see them having training error. Okay, so whenever you have injury, please reflect. Yeah, check your body weight. Are you overweight? Okay. Number 2, do you have any old injury that you have before but you did not get them treated in time? Okay. Number 3 is look at your running. Did you do anything special? Did you change your shoes? Did you change your training method? Did you increase your mileage too much recently? Okay, please reflect yourself. Okay, so please make necessary changes and then only your pain will get better. Okay, now, so these are 3 main proven risk factors that will put you at high risk of getting running injury. Okay, so now move into plantar fasciitis. Why people get plantar fasciitis? So plantar fasciitis happen commonly among people with change of running shoes. Yeah, so if you change your running shoes, for example, if you change from a cushion shoe to a lighter shoe, or from shoe to not wearing shoes, okay, these are the changing that will put you at high risk of getting foot problems. Okay, so if you were to change your shoe, you have to be careful. Okay, and second, change of running form. So a lot of us, we know heel strike is bad, heel strike is not good, so we want to change. So if you change your running form without a proper guidance, without a supervision by a running coach, you will tend to overcorrect, or you think you do it correctly but actually you are not. So you put extra stress to the heel and the ankle area. Okay, so you will tend to do forefoot landing a lot more because you're very scared to land on the heel, right? So you tend to land mid-foot, but you are actually over-correcting them. Okay, change your running form. Okay, the third reason why people get plantar fasciitis, which I observe very commonly in office, is the shoe. The shoes that they use is too old. Yeah, please monitor the shoe mileage. Okay, so a lot of time when I ask about their shoes, right, like I ask them how long you've been having this pain. They say, oh, I have this pain for 1 month already. So I ask, so the shoe that you're wearing actually how old already? How many km already? It's like your car tires lah. Yeah, mileage, how many thousand of kilometers they can run. So the shoe also have mileage. Yeah, so I see a lot of people, if their shoe is 800 kilometers and above, so these are the shoes that will put your foot and ankle at high risk of getting injury. Okay, so the shoe, we wear shoe because we want to protect our foot and also our ankle. But when the shoe is being overused, when you wear the pair of shoe, you run more than 800 kilometers and above, the protective nature of the shoe is no longer good. Okay, so if you're wearing that kind of shoes to do a lot of intensive training, this will put your foot and ankle at high risk of getting injury. Okay, so for those of you here who have plantar fasciitis, ask yourself, did you change your shoe recently? Okay, and did you try to change your running form? Is the shoe that you are wearing very old or over mileage? Maybe it's time to get another pair of shoes. Okay, yeah. So the fourth one, the last one, that is weak muscles around the leg. Yeah, so a lot of time when we treat people with plantar fasciitis, they will tell me, oh, you know, I feel my legs very tight, I feel the heel very stiff in the morning, so I do a lot of stretching, I do a lot of foam rolling, but it doesn't help much, right? So besides the stretching and flexibility, there's one thing that's very important, is also the strength. Okay, so the plantar fasciitis basically means the inflammation of something called plantar fascia. So plantar fascia is the structure that maintain the foot arch. Okay, so this is your foot arch. Yeah, so plantar fascia come from here to here. So if the plantar fascia is not strong, your foot will collapse. So can you imagine how strong is the plantar fascia in order to support your body weight when you are running? Yeah, so you need to have strong foot muscles, you need to have strong calf muscles. Yeah, why is calf muscles playing an important role in plantar fasciitis? Because plantar fascia and calf muscles, they share a common attachment area, which is heel bone. So calf muscles and the strength of plantar fascia is very important to maintain the health of your foot and ankle joint. Okay, so I'm going to show you a test. Yeah, so you can do this test at home right now. Okay, so I'm going to show you how to do it to check how strong is your calf. So if you are runners, you must be able to do this movement for at least 25 times on right leg and then left leg. Yeah, I'm going to show you how to do it now. Yeah, okay, let me adjust the camera. Yeah. So first, you stand next to something stable, which is a wall. Yeah. So if you are not stable, put your fingertips. Yeah, fingertips on something stable, wall or chair, furniture. Lift up your left foot. Yeah. Do heel raises. Yeah. Lift up your heel as high as possible. Okay. So I show you side view. Okay. Keep your knees straight. So a lot of time when people have difficulty doing it, they will do this. So this is wrong. Okay. Knees straight, heel up. Okay. So you are allowed to use your fingertips only to support yourself. Don't hold the wall. Yeah. So fingertips, maintain balance. Okay. Do this for 25 times non-stop. Okay. For demonstration purposes, I'm going to do 25 times. Yeah. So after you're done with 25 times on right leg, do it on your left leg. Same movement. Okay. For at least 25 times. Okay, so it's very simple test that you can do at home. Yeah. Okay, what you have to watch out when you're doing this test. Okay. Okay, someone type in comment for me. Yeah. So the first thing that you need to watch out is the strength difference between left leg and right leg. Yeah. Can some of you please type for me? Watch out in the comment. Yeah. Watch out the strength difference between left leg and your right leg. Okay. Okay. The second point is observe at which number of reps your calves start to feel tired, burning. Okay. So like for example, very common, people will tell me, oh, my right calf, I start to feel very tired, sore at the 15 reps. But on my left calf, I feel tired after 5 reps. So this is a very important message. That means both of your leg, it's not strong, and left side is worse. Okay, because you're supposed to be able to do at least 25 times almost effortlessly. Okay, so do the test. If you fail to do 25 times without much effort, that means you need to really work on your calf strength. Yeah, do more calf strengthening exercises. Okay, yeah. So these are some of the sharing that I can do for this morning. Okay, any of you here has any question you want to ask me, like burning question, before I proceed to what you can do in the morning to fix your own pain the moment you step out from the bed? Any question? No question? Can understand? Okay. Okay, if you're shy to ask here, you can PM me later. Okay, now, so people with plantar fasciitis, they will have a lot of pain in the heel or the ankle area or the foot arch area, first few steps in the morning. So how to relieve this pain? Okay, so what you can do, okay, I have to show you my leg lah. Okay, so you can see my foot, right? Okay, so a lot of time people with plantar fasciitis, they have pain here all the way up to here. So every time in the morning, before you step your foot on the floor, do this massage. Okay, so put your leg in this position, lift all your toes up, use your thumb, okay, massage the heel area. Okay, you will feel a little bit of soreness, or if some people even can feel something hardened inside. So move up. Okay, yeah, so you will feel a thick bend here, yeah, from the heel all the way up to the first toe. Yeah, so massage this thick band. Yeah. Okay, even though your pain is only here, but I will strongly recommend you to massage all the way up to the base of the toe, because this is where the plantar fascia is. Okay, so you have to do this one. Yeah, so it's basically like ultra running looping lah. So you loop from the heel, keep looping all the way up to the first toe. So this looping you only need to do 1 minute lah. No need to do 24 hours or 12 hours looping. Okay. Okay, after you're done with your 1 minute massage, yeah, so you have to wiggle your toes vigorously. Okay, so this movement will help to improve the circulation around the foot area and also a bit of strengthening for your toes. Yeah. Okay, and then the next step, one more last step is, okay, you got to stretch your leg. Yeah, so you have to, you can see the nut. Okay, so straighten your leg. Yeah, lift your ankle up. Keep your knee straight, because if you straighten, sometimes when you're very tight, you tend to bend your knee. Keep your knee straight. Lift your ankle up. If you can reach, use your hand to reach toes. And then the moment you do this, you feel pulling sensation from ankle all the way up to the back of your leg. Yeah, hold for 30 seconds or 1 minute. Okay, then only stand up and walk. Yeah, this will help reduce your pain in the morning. Okay, so repeat. Massage. Okay, massage 1 minute, looping from the heel, go all the way up, all the way down for 1 minute. Stretching, ankle straight. Okay, knee straight, ankle lift up, toe up, stretching. Yeah, so these 2 steps before you step on the floor in the morning, right? So any questions so far? So these are I've covered why people get running injury. Yeah, for those of you who just come in, I've covered why people get running injury. I've covered specifically why people get plantar fasciitis. Yeah, because of change of running form, the shoe is too old. Yeah, okay, and weak calf. I've also covered how do you know whether your calf strength is good or not. Yeah, a simple test, single leg raises at least 25 times. Okay, and I also covered what you can do in the morning to reduce your morning heel pain. Okay,